Welcome back. You're watching McLaren Port Huron's Today's Health, and I'm talking with Dr. Peter Tseng, and we're talking about preventive health care. So, Dr. Tseng, we've gotten ourselves to age 40 to 64. What are the top health issues for women in this age group?
Well, for this age group, the changes with their periods and changes with what the ovaries are doing tends to be the major concern. Eventually, periods space out and stop, and women go through what we call the menopausal change, which can have lots of symptoms, including hot flashes, night sweats, some mood changes, changes in the vaginal tissue, and therefore changes with sexual activity can be noticed. But we usually have to talk to these patients about these kinds of symptoms and these kinds of changes.
So I'm just thinking that as you get older and older, since more and more stuff is going on, these appointments get longer and longer, right?
Yeah, I do have a lot to talk with.
More and more things to talk about at that age. What health screenings are routinely recommended?
Well, as I mentioned, breast cancer screening has been found to be very effective at trying to reduce the mortality of breast cancer, and so we usually start somewhere around the age 40 for most women for mammograms. Still pap smears are still going to be important to be done on a regular basis. At age 50, we start to recommend colorectal screening. Most of the time this is done with a colonoscopy. That's not something that I do, but we can certainly help people to arrange that or talk to women about that.
Are there other tests that are frequently done in this age group?
There is a test called a bone density test that I tend to recommend, especially after the age of 60. And this is usually done after the menopause as well, to determine if women have fragile bones or something called osteoporosis. Some general things such as we're talking to patients about increasing risk for things like heart disease or skin changes like skin cancer. We also watch for things like pelvic relaxation, what's called vaginal prolapse. The supports to some of the pelvic organs can sometimes get lax, and this is something that we can be checking for as well.
And watching for, so there's lots of things to be thinking about in that age group. How about immunizations?
Immunizations that is very important. So women, certainly flu vaccinations can be done at a very early age, but especially women in the older age groups, it's very important. Pneumonia vaccination. Now there's a lot of talk about shingles vaccination, and there's a newer shingles vaccination available as well.
That's a good prompt, because I think we think we're done with our immunizations, and really it's kind of a lifelong thing, staying on top of that.
That's right, and probably for each age group there's kind of a different set of vaccinations and immunizations that are available.
I wanted to ask you just briefly about, we talked a little bit about menopause and all of those symptoms, and being a really big issue with this age group. What are the treatment options and hormone replacement therapy?
In general, if a woman's symptoms are not very severe, we try to do this without hormone therapy, without medications, but there are some situations where hot flashes are just so severe, or menopausal symptoms are so severe that treatment can be warranted. The treatments are broken up between hormonal and non-hormonal, but each has its own pros and cons and special concerns, but that is something that I try to address with women, and what options are available for those symptoms.
Okay, well, we're going to take another break and then come back and talk about women 65 and older.